Theraflu Expressmax Cold Night is a combination medication that is used to temporarily treat symptoms caused by the common cold, flu, allergies, or other breathing illnesses such as sinusitis and bronchitis. It helps relieve stuffy nose, sinus, and ear congestion symptoms, as well as watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. It also contains acetaminophen, APAP, which is a non-aspirin pain reliever and fever reducer. It's important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years, and some products are not recommended for use in children younger than 12 years. It's best to ask your doctor or pharmacist for more details about using the product safely. It's also important to remember that these products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, it's important to carefully follow all dosage directions. It's also recommended not to use this product to make a child sleepy, and to avoid giving other cough and cold medication that might contain the same or similar ingredients. It's best to ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drops/spray. When taking Theraflu Expressmax Cold Night, it's important to follow the directions on the package if it's over the counter, or as directed by your doctor if it's prescribed. Take the medication by mouth with or without food, and if your stomach gets upset, taking it with food or milk may help. Make sure to drink plenty of fluids to help loosen the mucus in your lungs. If you're using the liquid form, be sure to measure the dose carefully with a special measuring device/spoon, and if it's a suspension, shake the bottle well before each dose. If you're taking the extended release capsules, swallow them whole and do not crush or chew them. The dosage of Theraflu Expressmax Cold Night is based on your age, medical condition, and response to treatment, so be sure not to increase your dose or take it more often than directed. And if your symptoms last for more than 1 week, get worse, or occur with a headache that doesn't go away, rash, or fever lasting more than 3 days, make sure to contact your doctor. Some common side effects of Theraflu Expressmax Cold Night include drowsiness, dizziness, blurred vision, upset stomach, nausea, nervousness, or dry mouth/nose/throat. If any of these effects persist or worsen, notify your doctor or pharmacist. If your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, such as changes in mental/mood, e.g., confusion, hallucinations, shaking, difficulty urinating, fast/slow/irregular heartbeat, or seizures. Although rare, a serious allergic reaction to this drug is possible. Seek immediate medical help if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of potential side effects. If you notice any other effects not listed here, contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Acetaminophen is an ingredient in Theraflu Expressmax Cold Night. It's important to not take too much of it, as it can cause serious liver problems. Adults should not take more than 4,000 milligrams, 4 grams, of acetaminophen a day. If you have liver problems or are giving it to children, you should take less and ask your doctor or pharmacist for advice. It's also crucial to not take any other medications containing acetaminophen without consulting your doctor or pharmacist first. Many over-the-counter and prescription medications contain acetaminophen, so it's important to check the labels and ask your pharmacist if you're not sure. If you take too much acetaminophen, seek medical help right away, even if you feel fine. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, yellowing of the eyes and skin, and dark urine. Daily alcohol use, especially when combined with acetaminophen, can also harm your liver, so it's best to avoid alcohol while taking Theraflu Expressmax Cold Night. Before taking Theraflu Expressmax Cold Night, make sure to inform your doctor or pharmacist about any allergies you may have to its ingredients. This medication may contain inactive ingredients that could cause allergic reactions or other issues. If you have any health problems such as breathing issues, diabetes, heart problems, high blood pressure, kidney or liver disease, seizures, stomach or intestinal problems, overactive thyroid, or urination problems, it's important to consult your doctor or pharmacist before using this medication. Theraflu Expressmax Cold Night may cause dizziness, drowsiness, or blurred vision. Avoid alcohol or marijuana as they can increase these effects. It's important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. Some brands of this product may contain sugar, alcohol, or aspartame, so if you have diabetes, alcohol dependence, liver disease, phenylketonuria, or any other condition that requires you to limit these substances in your diet, be sure to speak with your doctor or pharmacist. If you are planning to have surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Children and older adults may be more sensitive to the side effects of this medication, so it's important to monitor them closely. If you are pregnant, only use this medication when clearly needed and discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using this medication as it may pass into breast milk and have undesirable effects on a nursing infant. It's important to be aware of potential interactions with other medications, as they could affect how well your drugs work or increase your risk of serious side effects. Always keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Theraflu Expressmax Cold Night are ketoconazole and levoketoconazole. Taking MAO inhibitors with this medication may also cause a serious, possibly fatal, drug interaction. It's important to avoid taking MAO inhibitors during treatment with this medication, and most MAO inhibitors should not be taken for 2 weeks before treatment with this medication. If you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines, be sure to inform your doctor or pharmacist. Additionally, the ingredients in this product are available in many prescription and non-prescription products, so it's important to check the labels on all your medicines to ensure they do not contain the same or similar ingredients as Theraflu Expressmax Cold Night. Using these drugs along with this product could increase side effects, so be sure to ask your pharmacist about using those products safely. Also, do not use this medication with any other antihistamines applied to the skin, as increased side effects may occur. Lastly, be aware that this medication may interfere with certain lab tests, possibly causing false test results. It's important to make sure lab personnel and all your doctors know that you use this drug. If someone has taken too much Theraflu Expressmax Cold Night and is experiencing serious symptoms such as passing out or trouble breathing, it's important to seek immediate medical help. In the US, you can call the local Poison Control Center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, agitation, confusion, flushing, hallucinations, yellowing of the eyes or skin, dark urine, and seizures. In children, excitement may occur first, followed by loss of coordination, drowsiness, loss of consciousness, and seizures. It's important to seek help right away if you suspect an overdose. Make sure to keep all your scheduled medical and lab appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. It's important to stay on top of your appointments to ensure you are getting the most out of your medication. If you forget to take Theraflu Expressmax Cold Night at your usual time, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. It's important to stick to your regular dosing schedule. When storing Theraflu Expressmax Cold Night, make sure to keep it at room temperature away from light and moisture. Do not store it in the bathroom and do not freeze the liquid forms of this medication. Keep all medications away from children and pets. It's important not to flush medications down the toilet or pour them into a drain unless instructed to do so. When the product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember, always follow the recommended guidelines for safe and proper disposal. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.